Dr. Wee, can you help me figure out how I should best use the Laser Touch 1 to help my TMJ pain?
Sure, sure. Do you know how to use that already?
Yeah, I've used it a couple of times on my knee, but...
All right, so you know that the electrical adjustment, you just do till you feel a slight little tingle, that's all. Okay, you don't need more than that. And while you do that, I'll show you on a chart the muscles that you're treating. So as you're treating there, you're basically working these muscles here that move your jaw up and down. But when these muscles get really tight, this little disc here between the jawbone and your skull gets compressed, and sometimes that creates a lot of inflammation and pain. So the idea is to let that relax. So what you're doing now by stretching your muscle and then treating it, if you find any knots or tender points, that indicates a trigger point or a trigger zone, and these tend to be responsible for triggering pain or spasm. So, and that's typically what you see with people at TMJ, that they say, well, my jaw just feels like it's locked up. Well, it's the muscles that are very tight. So you can do that multiple times a day if you have to. And you know, once your jaw is a lot better, then you just do it whenever you need it. And that's as simple as it gets. So how's that feel now?
Well, it's a lot looser.
A lot looser? Great. All right. Okay, well, that's basically how you treat TMJ. And you can even go a little higher, sometimes up into the scalp area or down the neck area or below your joint, the jaw itself, because it's all muscles around it that kind of have to work synergistically, but sometimes they you know, don't work properly because of pain and so on. So that's